Hi, everybody. It's Mrs. Bartels. I'm going to give you the lecture on Chapter 9. If you're in class tomorrow, you'll be getting it in class. Otherwise, you probably should be listening to this lecture because the quiz, again, don't forget, is on Friday for Chapter 7 and Chapter 9. If you're in person on Friday, you will take the quiz at TCD. If you are not there, if you're not at TCD on Friday, you need to log into the Zooms to take the quiz. Okay. So here we go. Let me find the PowerPoints really quick. Okay. All right, so chapter 9 is basically just a chapter about what happens to the body as we age. It talks about the changes, both psychologically, socially, and physical changes that happen as a person ages. Okay, so it's called the older person. So with medicine today, people are living a lot longer than what they used to live. We used to think to be in your 80s was pretty old. We have people living into their 90s and 100s. So people are living longer. As we age, we become at a bigger risk of certain things that we'll talk about in a couple of slides. What you need to know is, like I said, people are living longer. And there's two terms here. Gerontology is the study of the aging process. So people that are gerontologists are actually doctors that study how the body ages. Geriatrics is the type of care that somebody does, like they're taking care of the aging person. Just like pediatrics is taking care of kids, geriatrics is taking care of the elderly or the aging person. So your nurses at the nursing home are geriatric nurses. They're not nursing home nurses, but they specialize in geriatric care. You also need to know that aging is very normal. It's not a disease process. It is normal. We do it every day, every minute you are aging. Doesn't matter if you're 5 or if you're 15 or 25 or 95, you're aging every day that you live. Okay, it's a normal changes happen in the body. And normal changes in aging do not mean that the person will always become ill or dependent. So just because somebody hits 60 or 70 or 80, you might think of them as disabled or ill or need more care. That's not always true. Some 80-year-olds are as healthy as a 50-year-old, and some 90-year-olds are as smart or smarter than a 50-year-old. So don't stereotype what aging is. Okay. Again, it's a normal process. It's not a disease. What happens, however, as we age, it puts I'm so sorry, that's rude. I just yawned. It puts you at a bigger risk for illness, injury, and disabilities. So as we age, our risk to be getting hurt, having an injury, or having an illness, or having a disability increases. And I also talked earlier about psychological and social changes, which we'll go into more deeper in a couple of slides. Always remember, like the slide says, just because they're aging does not mean they're becoming ill, disabled, or dependent. Changes occur very slowly over time. So again, as we age, we're at risk for illness and injury. We have psychological and social changes, and the changes happen slowly over time. It's like you don't wake up from being 12 and all of a sudden, the next day you have, I don't know, sorry girls, breasts. Okay. Or like boys, you don't go to sleep at 16 and the next day you wake up and you have facial hair. It all happens in a gradual process. Most people adjust very well with aging and have healthy, normal lives. Okay. These are common stereotypes that you should not have about the aging. All of them are untrue. They're not unable to take care of themselves. They can manage their money. They're not always grumpy. They're not always grouchy. A lot of them can remember things. A lot of them try to stay independent. So a lot of these are fake and false. Okay. Growth and development. There's two different things here. So growth is when somebody is growing and you can measure it. So like an example would be when a baby is born, they say that the baby's measurements, the weight and the height are this. And then when you take that baby back to the pediatrician for like the 1 week follow-up, they do a height and weight again. And then when they go back for their 1 month follow-up and their 3 month, all the way until they are adults, that pediatrician, basically that doctor, is keeping track of the height and weight of you. And they kind of graph it out in the patient's chart. So a lot of times for babies, they'll do height, weights, head circumference, like how big is the head. They might do a chest measurement, And then they keep, as the baby comes in, each time they are recording that. And that is, they're recording the growth. They're measuring what is going on. So growth is physical changes that are measured and that occur in a steady and orderly manner. Okay. Development is different. Development has to do with how you are progressing through life mentally, emotionally, and socially. Okay, so it's not the same thing. Somebody can be 5'9" and become 6'2". Just because they're 6'2", they could have a development. Their growth. They look like a grown man. I mean, here's an example. My 14-year-old is 6'1" and has a very deep voice and is a very big kid. If you look at him, you would think he's probably 16 or 17. But developmentally, once he starts talking, you listen to him, you're like, oh, that's a kid that's still in 8th grade. He talks about Xbox and he talks about, so he doesn't have a girlfriend yet. So developmentally, he's right where he needs to be for 14, but his growth, he looks like he's 16 or 17. Okay, so again, growth is measuring. Development is how are they mentally, emotionally, and socially. In order for a person to have good development, they have to meet certain tasks. Know what a development task is. It's a skill that must be completed during a stage of development. They're in your book, so I suggest you look at them. Look at the ones for your age. Have you met them? Many of you guys are probably going into the young adulthood, past the age of 18. When you look at those tasks, you guys are starting to develop your education, making career decisions. Some of you may be in relationships. I do hope that none of you are thinking about marriage or birth of child yet, but that's okay. But if you look at the development task for your age, see where you're at. Are you on task or a little bit above? Okay, and that's in your book. I believe the second page of the chapter. Okay, just know that a development task is a skill that must be completed during a stage of development. So when somebody is a newborn, they should expect to do this. When somebody's a toddler, they should be doing these development tasks. We cannot skip the task. If you skip the task, the person's not developing correctly. Okay, so certain skills must be completed during each stage, and you cannot skip those tasks. An example of this, and my students know this, is my son Michael, who's 14. When he was a baby, he never crawled. He would basically scoot on his butt everywhere, like his legs were broken. And I kept telling the doctor, every time I put him in the crawling position, he falls out onto his belly and screams, rolls over, and wants to push himself on his butt, like scoot everywhere. And the doctor's like, it's not a big deal. He'll figure it out in time. And I said, no, this is kind of a big deal, I think, because crawling is really important. And our doctor was like, yeah, he'll figure it out. And Michael went from crawling, or not, from doing no crawling, to scooting on the floor, and all of a sudden pulling himself up and starting to walk. So we're like, great, he's walking. I kept saying, no, he skipped crawling because I thought that was an issue. And sure enough, it caught up to him later on in life because when he started to hold pencils and try to write, his hand muscles weren't as developed as they should be. And he had a really hard time with that. He had a hard time figuring out how to climb up ladders or go up slides at the park. And it's because when you learn to crawl, you learn to use those finger muscles and strengthen them. So we figured out when he skipped the task of crawling, it caught up with him later on in life because he had difficulty, and he landed up in therapy for a while, about 4 years of therapy, physical and occupational. So those development tasks are very important. Again, they cannot be skipped. Each stage builds on the other stage. Okay. So some psychological and social changes that happen as we age. Retirement happens, and that's supposed to be a reward for a lifetime of work. It's supposed to be an enjoyable time. However, it also brings a reduced income, so sometimes there's some financial problems there if people don't plan appropriately. Social relationships are going to change throughout life. You guys probably know that. Your best friend from 6th grade might not be your best friend now in senior year of high school. Okay? Same thing happens with the elderly. As we age, different things change. Marriages might fall apart. Kids might grow up and get married and move away and have their own kids. People might lose their spouse. So, and then as we age, we might need more care from our family, where our children become caregivers. Make sure you read about children being caregivers in your book. It's basically where, as we age, our children might have to come back home to help us out a little bit, maybe with just house chores, or it might turn into full-time nursing care or care of their parent, and that's the children as a caregiver. Then also, that's on your test, children as a caregiver on your test. There's only a little bit on the slide, so make sure you look in your book about it. And also on your test is about a partner dying. You have to understand when a spouse dies, that person is losing their best friend, their confidence, somebody who they've been through everything with for years on end. Okay, their lover, um, their husband, their wife. A spouse is a lot. So no matter how much a person prepares for death of a spouse, it's never going to be enough. Even if you know your husband or your wife has cancer and they say they have 6 months to live, and you do everything you can in those 6 months to make it the best 6 months, when it does happen, it is still crushing, it's still devastating. Okay. The loss is crushing. There's no amount of preparation that's ever enough. Sometimes the spouse that's left behind, who's still living, starts to have physical and mental problems. And sometimes they lose their will to live. And you'll hear sometimes they say, oh, he died of a broken heart. Like his wife died, and then a couple months later, he was gone. He died of a broken heart. He just didn't want to live any longer. Okay, so know about the death of a spouse. Physical changes. In your book, there's a blue page that talks about all the different systems of the body and the changes that happen. So we're just going to go through them really quick. It's very simple. As we age, this is what happens with our body. Everything begins to slow down. The blood flow is not moving as fast. So that is why things are slowing down, meaning our blood isn't getting to our organs as fast. Another thing that happens is things start to lose their elasticity. So they start to sag or wrinkle. Okay. So things slow down, they start to sag, they start to wrinkle, they eventually will either stop or die off. Okay, so that's basically what happens, whatever system it is. And we're gonna go through the systems really quick. So, like the nervous system, what happens is the brain doesn't move and think as quickly as somebody who's younger, so the reflexes are slow, um, and the blood flow is slower to the brain. So sometimes they're more forgetful, and it takes them a little longer time to process things than what maybe a 17 or 19-year-old could process. They also have a reduced sensitivity to pain, pressure, and touch because their nerves are starting to die off. Everything starts to dry up and die off as you get old. Okay. They also have a very hard time with different, like bright lights is very difficult for their eyes. A lot of glares happen and they don't like the bright light. They prefer dim lights. And high pitched or fast talking is really difficult because their hearing is starting to go. So they have a loss of hearing, they'll have a loss of eyesight or a decrease in their hearing, a decrease in their eyesight, a decrease in their flexibility, a decrease in their reflexes, a decrease in their feeling. Okay, so that puts them all at a risk of maybe getting burned because they don't feel things getting hot on them. Um, Maybe if they have a glare, they might trip over a rug because they can't see correctly. Or if they can't hear, they might not hear the phone or doorbell, or worse yet, of fire alarm going off in their house. Okay, so those are things that happen with the physical changes in the nervous system. All right, the next thing that we're going to talk about is the integumentary system, which is the skin. What happens to the skin as we age? You know, we all get wrinkles. Okay, the skin becomes less elastic. And when we use that word, think of a rubber band. A rubber band is very elastic. You stretch it and it goes back to its shape. You stretch it and it goes back to its shape. But as we age, our skin stretches and it starts to sag and wrinkle. It does not go back to its shape. So the elasticity is less. They also have a decrease in oil and sweat glands. So their skin gets very dry very easily. So that is why we only shower them twice a week and we do like sponge baths in between. We make sure that we use plenty of mild soap and lotion to keep their skin hydrated. The nails become very thick and tough. If you've been to clinical, think about some of the toenails that you have seen. Old people don't have pretty toenails. Okay. The nails are much thicker, they're tough, they can become brittle, they can have disease, they don't look pretty. Okay. Another thing that they're at increased risk of because their skin is really thin and it doesn't have that strong elasticity and it starts to sag and wrinkle, they're at risk for skin breakdown and pressure injuries. The musculoskeletal system is our bones and muscles. Okay, so of course, as we age, our muscle mass starts to decrease. There's not many 95-year-olds that look like Arnold Schwarzenegger or Rocky or like a big fighter or a guy that's going to the gym. They're not all built because their muscles are going to shrink. They get a lot of arthritis where the joints become stiff and they don't move as quickly as they should. So they have decreased mobility and they shrink. What happens is the spine has like the vertebrae have cushions called discs between them. And as they age, those discs start to wear down, and then the spine starts to become shorter. So your grandma might be getting shorter. It's not that you're getting taller, it's that grandma is shrinking, and that is true with age. Okay, the thing with the musculoskeletal that you're most at risk for is their bones are very brittle, so they're at risk of easily fracturing themselves if they fall, having broken bones, and they also have a lot of hard times moving because of their stiff joints. Okay, what you could do for them is encourage them to drink and eat healthy. A diet that's loaded with calcium and vitamin D is really good for this, and help them to exercise, even light aerobics or light weightlifting, because it builds bone mass and it builds muscle. And if they cannot exercise, you do those range of motion exercises for them and encourage them to do as little, as much exercise as they can. Okay. Circulatory system is your cardiovascular system and your veins and arteries. So what happens with that? The blood is starting to slow down. The arteries are not big, thick pipes that have open areas. Instead, they're getting very narrow. So the arteries are starting to have plaque buildup in them, or like cholesterol buildup in them. So instead of being really big, thick, like pipes that blood can just flow through, the blood starts to get more difficult to flow. Okay, so there's less blood flow because the arteries are smaller, and that can lead to increased blood pressure. It also leads to increased risk of heart problems or stroke problems. Okay. If somebody does have cardiovascular changes or heart changes, you need to modify their exercise. You need to follow the care plan and make sure you're not over-exercising them. You have to encourage them to have a lot of rest and then exercise, rest and then exercise. You alternate it. You don't do a bunch of exercise or strenuous exercise. It might be, let's go for a walk halfway down the hall and then let's stop. Okay. And then it might be later on, we'll go for another walk instead of trying to do the whole hall in one walk. Okay. So with circulatory system, again, remember the blood flow decreases, and therefore they are at more risk of high blood pressure or heart problems. Respiratory system is on your test. The respiratory system, again, everything in our body weakens as we get old, so our lungs start to get weakened, and the diaphragm and the muscles that we use to breathe, take those nice deep breaths and cough in and out and clear our throat and clear our lungs. That gets much more difficult for an older person. Okay, so they're not good at taking those strong, deep breaths or coughing and clearing the airways. So you have to encourage them coughing and deep breathing. Okay, if they're short of breath, you have to encourage them to take time to, exercise and then rest. So they have dyspnea, which is shortness of breath. It might be you're doing small amounts of activity, then rest small amounts of activity. You know to sit them upright if they're having a hard time breathing. You know how to do the cough and deep breathe. Remember, deep breathing in and then out for the pursed lips, in for the nose and out for the pursed lips. And you want to encourage them to cough as much as possible to clear the airways so they don't get the risk of pneumonia. The digestive system, our gut gets very sensitive as we get older. We have a hard time tolerating certain foods we could have done when we were younger, especially fats. So they have difficulty digesting fatty foods or fried foods. They get a lot of heartburn or indigestion. And then the gut starts to slow down. So the colon starts to slow down. It's called peristalsis. The movements of the colon is not moving. So peristalsis is how your gut moves. And what happens is your gut starts to slow down, have a slowed peristalsis or a decreased peristalsis, which can cause a buildup of gas and constipation. So they're going to have bowel problems. Okay, they also lose their teeth, which makes it difficult for them to eat. If they're having bowel problems or constipation, we learned about this. What we do is give them a high fiber diets, and we also make sure they're drinking plenty of water or fluids so that stool does stay somewhat soft and not get dry and hard from the constipation. Okay, if you notice your patient's not going to the bathroom or they're having a hard time going to the bathroom, you need to report that to the nurse because there's medications she could give as well, besides the high fiber exercise and increasing your fluids. Okay. The urinary system. So with the urinary system, the bladder is like a balloon. And as we age, the bladder has been stretched out and it doesn't really have strong muscles any longer. So the bladder becomes kind of lazy and weak, and people might not be able to empty their bladder completely. They might have dribbling going on. They might have a little bit of incontinence going on. They also run a big risk of running urinary tract infections just because the bladder is not functioning as well as it used to. It's slowing down, it's not emptying correctly. In the reproductive system, the males have what we call a prostate. The prostate sits down in the scrotum, right around the urinary area. So what happens is the prostate, as a male ages, enlarges, and as it enlarges, it pushes up on the bladder, and then the bladder does not empty correctly, and the person can have urinary incontinence or bladder problems. Okay, so again, with the prostate in a male, the prostate gland enlarges, and that can cause frequent and incomplete emptying of the bladder, including dribbling, urinary incontinence, and the feeling that they're full all the time and they can't go. Okay, so know what happens with the male prostate gland. That's on your test tube. And then with the women, our reproductive system, everything kind of just starts to sag, fall down, dry up. The good thing is we don't get a period any longer, but we also are going to have our uterus is going to start to drop a little bit. It's called atrophy, and it weakens the vaginal area as well. And then there's thinning of the vaginal walls, and there's dryness. So the good news is the period stops, but then you have all this other stuff that's going on down there. Okay. Nursing care center care. So we know that a nursing home is a place where people go when they're not able to take care of themselves. We know if they're able to do a little bit, but they're not safe to be at home, they might land in assisted living. But if they're unable to take care of themselves, so older persons who cannot care for themselves land up in nursing centers. This just talks about the things that happen when they go to nursing center. They lose their possessions. They lose their house sometimes. They lose their feeling of independence. They sometimes forget what's going on in the real world because it's the same thing day in and day out at the nursing home. They lose their health and their mobility. They can lose their identity as a protective member of the family or community. Oh, grandma, yes, she's at the nursing home, but nobody ever thinks about grandma anymore. Okay, but know that nursing homes are where people go when they can no longer care for themselves. Okay, sexuality, I know it's awkward, but we're going to talk about it because every person has a need. Every person has a need for sexuality, whether it be you guys at 17, 18 years old, or whether it be your parents, which I know you think is totally gross, or even your grandparents. It does not matter. They are human beings, and human beings have needs. They have the need to be loved, they have the need for affection, and they have the need for intimacy. Okay, it just is expressed in different ways as we age. Young adulthood, you might be very sexually active, but as we get older, the sexual intercourse is not the important thing. Okay, it's more or less the affection or the hand holding or knowing that you feel loved and important to somebody. The frequency of sex decreases as we age due to weakness, fatigue, pain, decreased mobility, chronic illness. You just don't feel like doing it. Okay, so sex might decrease, but the need to feel affection and love is still there. Sometimes how do they get that a feeling? How do they do that? They're not having like sexual intercourse. You'll see hand holding, touching, caressing, or embracing. Okay, hugging, loving. It might just be simple as like holding hands on the couch together. You guys are like, oh my God, mom and dad, stop it. No, mom and dad, don't stop it. Mom and dad, that is so beautiful to see, is what you should be saying, because your parents are comfortable with each other, giving each other comfort and affection. They're meeting each other's needs. Don't get grossed out by it. It's okay. So also, if a married couple lands up in a nursing home, OBRA says they can live together in the same room, which, could lead to things, but it's allowed. They say if a married couple is in a nursing home together, they should be allowed to room together. Okay. How do you meet the sexual needs of an older person? I know it's awkward, but you also have to understand, like I said, they're going to have needs, they're going to have wants, and they're going to do things. So how can you respect that? First thing is giving them privacy. Always knock and wait for permission to enter before you go into somebody's room. You never know what you might be walking into. You never know if they got a girlfriend or boyfriend in there. You don't know if it's going to be an awkward conversation on the phone. You don't know if it's a video they might be watching. You don't know if it might be an action they're doing with somebody in the room or by themselves. Okay, but you want to knock to alleviate their invasion of privacy and your shock of what you might see. If you encounter any sexual situation between consenting adult residents, you have to allow it to happen. As long as they are okay with it and they both consent to it, you provide for privacy and you leave the room. So, maybe, I don't know, let me give you an example. I'll just make up some names. Mr. Simmons in room 212 and Miss Williams in room 214. Okay, Mr. Simmons and Miss Williams in 214. They are not married, but they both eat breakfast and lunch and dinner together every day in the nursing home. Okay, if his family's coming to check him out at a nursing home, she wants to know, when is he coming back? Where is he going? Okay, it's obvious that these two have a connection. So if they want to go into a room together and they're both alert and orientated and they want to hold hands together, or maybe they want to watch a movie together and lay together, you have to allow that for privacy as long as they're alert and orientated and they're consenting to it. Do not judge residents or their families about sexual choices, sexual orientation. It doesn't matter. It doesn't matter what that person chooses, and you know this in the age that you're living in. Sexual orientation, sexual choices are open. They're very individualized. You might not believe in same-sex relationships where somebody else does. You don't have the right to judge anybody. If a sexual situation is disturbing to you and you're not sure or feel it's inappropriate, get the nurse. Okay. Another way that you can help with the sexual, because like I said, meeting their sexual needs. Another thing you can do is when you're getting dressed, encourage them to pick out what they want to wear so they feel good about themselves and they look good. Because let's be honest, when you look good and you feel good about yourself, you feel like you're on fire, and you want your patients to feel that way. So if they want to put makeup on, go ahead and let them put makeup on. If they want to get dressed in a certain thing, as long as it's appropriate and not everything's hanging out in the dining room, let them do it. Okay. So that's another way you can meet their sexual needs. Again, people want to feel like they belong. They want to feel important. So they look good. They feel that way. All right. Sexual aggression. Do people get sexually aggressive? Yes. Are they inappropriate? Yes. But it's just not in a nursing home. It's everywhere. I mean, you could go get gas somewhere and some guy in a truck's going to whistle at you as you bend over to pump your gas. And you're like, really, dude? Okay. You can handle it two ways. You could be like thumbs up at the guy and wave at him, or you could be like, don't ever do that again. But is he really harming you? I don't think so. When it becomes harmful or when it becomes awkward, you need to speak up. But you also need to understand some people, especially people we're caring for, do not know they're being sexually aggressive. You have to understand, often there are reasons for the person's behavior. Okay? Why are they doing what they're doing? If they're touching their private area or they're rubbing on their private area, it's not always because they're a dirty old man who wants to get, who's being sexual. It could be a couple different things. It could be for pleasure. Okay? It might be that they have a sore down there or they're itching. It might be that they are wet or they have poor hygiene. Okay? It might be a sign of a urinary tract infection. So what you need to do is say, Mr. Smith, stop touching yourself down there. Mr. Smith, do you hurt down there? Mr. Smith, is there burning down there? Mr. Smith, how about if we take you back to your room, make sure that you're clean, and I take a look down there for you. Okay? And if you don't see anything, he's not wet, okay, then it is a pleasurable thing that he's doing. But you have to rule out the things. Sometimes the purpose of touch is sexual. You must understand that if they're doing and you have to understand too, a lot of times they have dementia, they have some kind of underlying mental illness. They don't realize what they're doing is wrong, and they didn't mean to offend you. Okay? But sometimes the purpose of touch is sexual. So it's not that, and it was intentional. You have to be professional about that. Okay? You can't be like, you can't be turning around and going, hey, let me grab your boob because you grabbed my boob. Okay? You can't do that. You can't be like, don't touch my, you can't grab my tit, excuse my language, but seriously, you cannot be like that with him. You have to be professional about the matter. So ask the person not to touch you. Just say, Mr. Smith, I think you touched my breast, and I really think that is not appropriate. That is not a professional. That's not the behavior that we should have as a nurse and as a patient, and I need you to understand I don't want you to do that again. Okay, that's a great way to handle it. Say, instead of smacking his hand away and saying, don't touch me there. Okay, just say, I think I felt you grab my boob, and I'm just using the breast as an example, and that is not appropriate, and I don't want to have you do that again. Do you understand? That is not what I want from you. You're very to the point, very direct and very to the point, and you tell them no. And if it happens again, even though it happened this time, you still tell your nurse, if it keeps happening, the nurse needs to know every time it happens as well, because if he's doing it to you, he could be doing it to anybody else. Okay, and his behavior needs to be corrected. Tell the person that you will not do what he or she wants. So if he's asking, hey, come on over here and, can you give me a nice back massage? And it's not because he, or, when you're rubbing, like, his, maybe you're giving him a back massage and you are on his lower back and he's like, ooh, lower, lower. No, Mr. Smith, that's inappropriate. I'm not going to do that. I'm giving you a back massage. I'm not going to go lower on your back. If he's trying to get you to touch his butt or his private area. Tell him what the baby hair was. Just say, Mr. Smith, it's inappropriate. I'm not going to rub lower. I'm doing your lower back, and I will not go any lower than your lower back. But my butt hurts. No, Mr. Smith, I'm not going to do that. I can look at it, see if there's sore or anything, but I'm not going to rub your butt for you. Okay? And you're telling him, it's making me uncomfortable. I don't like you requesting that. I don't like you doing that. Please do not do it. Allow for privacy if they become aroused. Okay, if you notice you're giving somebody a bath or doing pericare and things are getting a little different in that area, just tell them, I think I'm going to leave now and I'm going to pull the curtain. I'll come back and check on you in a little bit, because you don't need to sit there and watch that or be part of that. Discuss the matter always with a nurse and follow the person's care plan. Some care plans will have, if the patient's sexually aggressive, what to do with it. And if he continues, if the care plan doesn't have anything, but it's a behavior that's noted over and over, the care plan needs to be updated so we know how to handle this man. And also understand, not only you're protecting yourself from the sexually aggressive person, there are plenty of people in a nursing home or assisted living who might need to be protected because they're not able to say no. So you making sure that you guys identify who the sexually aggressive person is not just for you, it's also for those other residents that you need to protect. Okay. If they're not volunteering to it, if they're not consenting to it, that is sexual abuse. Okay. So if you notice that Mr. Smith keeps rubbing up on Miss Williams and Miss Williams keeps trying to roll away from him, he keeps coming closer and she's not uncomfortable and you can tell she doesn't want that, you need to separate them. Tell Mr. Smith he's inappropriate and get the nurse, because that is really physical sexual abuse on Miss Williams. And it just depends on what he's been doing. But if it's, I've seen, you guys, I've seen so much. I've seen one of my patients with my students say, we were in the activity room with them, they were doing karaoke and they were playing like oldies, so that my students were like singing and dancing and just trying to interact with the patients. And one patient was like tapping his legs to the music. And then as my student went around to talk to him, his name was Walter, he's like, yeah, he was tapping his lap. He wanted her to dance on his lap. And I said, Walter, that's completely inappropriate. And I just told my student, Alyssa, move away from him, because he was smiling and she was dancing in front of him thinking it was cute. And all of a sudden he's like, yeah, and he's like tapping on his lap, but his face completely changed to the point that he was enjoying it for a different reason. And then the nurse said, Walter, we need to take you to your room. So Walter went to his room. Okay. It's going to be hard for you guys. It's going to be awkward, but you need to protect yourself and protect the other residents and report it. And we are done.